Hi, it's Dr. Jamin. Today we're going to be talking about asthma. Asthma is a condition that seems to just be a ton of inflammation. When this person is moving, walking, talking, exercising, and all of a sudden their lungs are unable to keep up because they can't get enough air, it feels like everything is inflamed. So why is this happening? Well, when you look at medicine, what we always think about is, let's just throw anti-inflammatories at it. Let's stop the body from reacting. But what is the root cause of asthma? Why is it there is the biggest question that we need to get to. And when I first went into practice and I was working with people, when I'd look up asthma, functional medicine doctors say, well, it's yeast, or it's inflammation, or it's food allergies, all of which would have a good effect on decreasing asthma. So I go, all right, so it is inflammation. Something is triggering inflammation in the body, leading to a person having an asthma attack. But what about all these patients that I work with that have Lyme disease, that have air hunger, they have rib cage tightness, so they just feel like they can't breathe because their rib cage is so tight when they're doing detox protocols, or their lymph backs up and their body just feels so heavy they don't feel like they can really breathe or expand their lungs. So if I take that back to just exercise-induced asthma, if I take that back to just people who are dealing with asthma when it's a certain temperature or barometric pressure, I said, well, could they be on the same page? So here's what it led me to, is if we can get at the root cause of what is causing your body to have this extraordinary inflammatory reaction in the lungs, which is usually a toxic, meaning metals, toxin that came from some sort of infection, or any of the environmental junk that we run into on a daily basis that's in our air, because asthma tends to get worse when you're dealing with that. Creating inflammation, because inflammation doesn't come from just anywhere, it comes from something. It comes from toxins and infections. And then we have that stagnation, which is that lymph backup, so we got to get it moving, so that's through detoxing. Then we can get asthma to go away. That was the theory. And then I've worked with patients now, and although sometimes it does not cure asthma, it makes it so much better. It decreases symptoms to get everything moving. I have had it go to where patients that used to have exercise-induced asthma report having no issue at all. They still take their inhaler, but they just leave it, in their bag sitting on the side. I've had patients who used to have difficulty breathing through certain times of the year and go completely away. So where do we do this and how do we do this? Well, we start with we go, what do we need to detox? So we run some testing, or we talk about your environment. We look at your assessment, so big questionnaires of what could possibly be going on in your body. We start with drainage to get the lymph back up and the stagnation to decrease. And then we work on inflammation by getting rid of the toxins or infections that are in your body that are leading to these increased inflammatory, increased immune reactions that shouldn't be there. So if you have asthma or you know somebody with asthma, get this video out to them so that they can get an understanding of what might be able to help them, so that they're not dependent on medications forever and they can take their own health into their own hands, because that's what this is really about, is giving you the power back to control your own health. Hope this video got your mind going, because asthma is not the only thing out there that has a trend like this. So if you have any questions or idea, guys, just post them, ask us. Have a great day.